Hello and welcome to this special presentation on how non-surgical spinal decompression successfully treats disc conditions when other therapies have failed. My name is Dr. Chris Cameron, and if you're suffering from any type of disc conditions, whether it's herniated disc, bulging disc, degenerative disc disease, facet syndrome, or spinal stenosis, this webinar is the right place for you. The information I'm about to share with you will help you make an informed decision about the health of your back moving forward. Now quickly, who am I? I'm a chiropractor with 25 years of experience. I practice in Lucan, Ontario, and I specialize in non-surgical spinal decompression. My clinic is the only one in southwestern Ontario that offers spinal decompression along with deep tissue laser therapy, shockwave therapy, electroanalgesia, and high frequency vibrational therapy.
I thought it was my hamstring was hurting for about 15 months, and I hated driving because sitting was killer, like it was so bad, and I had been making a lot of longer trips, so that was not fun at all. And even exercising, like pretty much everything hurt, or I would at least be thinking about it while exercising because of the pain. I saw some of your videos on Facebook and I thought, well, maybe he can help me, and then you did an x-ray and saw that it was actually my sciatic nerve.
Yes.
So I've been on the decompression bed and I feel a lot better. And now there's days and days that I don't have to think about it because the pain's not there. It works. And it's pain-free. It's actually pretty relaxing. You're just laying there, and they have nice music, and yeah, it's good. I was nervous too the first time, but then after that, you're like, oh, this is awesome.
We have invested in our state-of-the-art equipment and training specifically to diagnose and treat specific disc conditions, often when other treatments have failed. What are the facts on back pain and disc conditions? Let's start with some statistics on back pain in Canada. Back pain is one of the most common chronic conditions in Canada, affecting over 4 million Canadians annually. 8 out of 10 Canadians experience back pain at some point in their lives. Sedentary lifestyles contribute significantly to back pain, with prolonged sitting being a major risk factor. 9 out of 10 patients never receive a clear diagnosis for their back pain, making it difficult to choose the right treatment option. Back pain is the second most common reason for a doctor's visits following colds and flu. The economic burden of back pain in Canada, including its lost productivity and treatment costs, exceeds $6 billion annually. When we specifically look at disc-related issues, more than 50% of people over 50 have some degree of disc bulging. Men are twice as likely as women to suffer from a disc-related condition, often due to physical labor, sports injuries, and accidents. 90% of disc bulges occur in the lower back, which is why so many people suffer from sciatica and radiating leg pain. Aging is a key factor in degenerative disc disease, with over 60% of adults over age 60 showing some form of disc deterioration. Over 75% of back surgeries are performed due to unresolved disc issues, yet a large percentage of them result in failed back surgery syndrome. What are the common conditions we treat with spinal decompression? Spinal decompression is highly effective for bulging or herniated discs when the soft cushion between the vertebrae is compressed or displaced. Sciatica, irritation of the sciatic nerve, which runs from the lower back down the leg. Degenerative disc disease, when discs lose hydration and shrink, leading to pain and stiffness. Facet syndrome, degenerative or damage to the joints of the spine. Pinched nerves, causing radiating pain, numbness, or tingling in the back of the leg and feet. Chronic lower back pain, especially cases that have not responded to other treatments. Spinal stenosis, narrowing of the spinal canal, which can put pressure on the nerves and cause severe pain. Post-surgical back pain, where the traditional surgeries have not fully resolved the symptoms. What are some symptoms of disc problems? If you're experiencing any of these symptoms, you may have a disc condition. Pain that radiates down your legs, numbness, tingling, or burning sensations in your back, legs, or feet. Weakness in the legs or trouble walking. Pain that gets worse with prolonged standing, but improves when sitting down. Pain that disrupts sleep and worsens after physical activity. Frequent muscle spasms and stiffness in your lower back. What are some common causes of disc conditions? Car accidents, work injuries, and the weekend warrior. How do you tell if it's a disc problem or a muscle issue? One of the biggest mistakes people make is assuming that back pain is the same. Many people are treated for simple muscle strains when they actually have a disc problem. Here's how to tell the difference. A muscle strain typically heals within 6 to 8 weeks. If you've been in pain for months or years, it's likely not just a muscle issue. If the pain is severe, 8, 9, or 10 out of 10 on a pain scale, and affecting your daily activities, it's more than likely a disc condition. Pain that radiates down the leg is often a sign of a compressed nerve caused by a bulging or herniated disc. Persistent pain that worsens when sitting for long periods or when lifting objects. Tingling or numbness that spreads gradually over time. What are the common treatments for disc conditions? Drugs. The first intervention usually is drugs. Although drugs can temporarily ease the pain, they often mask the underlying cause. If medications are not solving the low back pain after 1 to 2 weeks, then you're probably dealing with a disc issue. If anti-inflammatory meds and painkillers don't work, then patients are often prescribed gabapentin, which often does not work either. Surgery is another common intervention, but it should be a last resort only after more conservative and effective approaches like non-surgical spinal decompression have been tried for at least 3 months.
My back, very bad. Sciatic, lower back pain, and a lot of pain. Just wasn't living life. I was off work for probably 6 months. I was doing physio, and I was taking a lot of medication, a lot of narcotics. I couldn't work, I couldn't do daily tasks around my house, I couldn't cut grass, I couldn't hardly even make it to the bathroom. It's gonna take time and it's gonna take willpower, but it's worth doing. It's definitely changed my life. I'm back to full-time work because I can do some overtime. I can do my daily tasks, clean the house, do the dishes. I know it seems funny, but those things you don't want to do when you're okay, but when you're not okay, just doing the dishes is just like, wow, I'm back to normal. I'm very comfortable being here too. So I would say just pick up the phone and make that call because it changes your life.
What we do is different and effective. What is spinal decompression? Spinal decompression is not a new thing. It's been around since the early 90s and has a lot of great research behind it from places like Harvard, Yale, and Johns Hopkins. You might be familiar with traction. Traction has been around since the 1950s, and that's essentially where you're gonna be laying on a table and essentially it's gonna stretch you. It's non-specific, and the only similarity between decompression and traction is that you lay on a table. There are several different types of decompression tables. Some with cables that pull on the spine. Unfortunately, these types of tables are not as specific or gentle as newer tables that have a pulling action built into the table. I use a Hill DT table, which has sensors built into the table, allowing for a precise angle and strength of pull, resulting in more comfort and better results. The real big difference between spinal decompression and traction is that spinal decompression is specific to the level of the disc bulge. If you have a herniation at L4-5, it's going to treat the L4-5 disc. The other big difference between spinal decompression and traction is that spinal decompression is going to distract and release multiple times over the treatment time period. Traction just pulls and holds in one sustained pull. The magic of spinal decompression is in the repetitive pull and release over the 20 to 30 minute treatment plan. The disc is 85% water. When we have disc conditions such as herniations or bulges, the disc has lost water content. The best analogy I can give you is the tire on your car. Picture the front left tire on your vehicle, and it's full of air, 45 psi. Now picture that tire at 20 psi, flat and soft. It's supposed to be full to do its job properly. A hernia disc is like a flat tire. It can't do its job properly. Spinal decompression creates a negative pressure in the disc to suck fluid back into it, allowing the disc to do its job. This reduces the pain on the nerve and improves the function of the spine. Decompression is a process of pulling and releasing. It creates negative pressure in the middle of the disc that allows the disc to absorb water from the body and get healthy again. A common question I get is, What else can I do? What about physical therapy, chiropractic massage, or surgery? Physical therapy will strengthen the muscles around the spine, but it's not going to pull water back into the disc. Chiropractic is going to help restore motion to the spine, but it's not going to pull water back into the disc. Massage therapy can help loosen the muscles, but again, it's not going to pull water back into the disc. And surgery, it's certainly not going to put any water back into the disc.
I had been 2 to 3 years of constant pain in my back and my leg. I had seen a physiotherapist, a regular chiropractor, massage therapist, and a specialist in London with no sign of any relief. I was unable to sit or stand for a long period of time, constantly having to rotate between the two. I wasn't able to stand for very long to cook dinner. I couldn't garden. I couldn't do any of my hobbies. Pretty much spent a lot of time just sitting on the couch trying to relieve the pain. Come give it a try. It was significantly better right away, and it gave me a lot of hope that we could get it completely fixed. I'm probably at about between 70 and 80% pain-free. I am able to sit for a lot longer periods of time at work. I don't have any pain during the day at work anymore. I'm able to cook dinner, able to basically get back to most of the things I was doing. One of the major things I'm able to do is drive again. Driving was very painful before we started the treatment.
Is spinal decompression safe? Absolutely. The process is controlled by advanced computer algorithms that adjust the treatment based on your specific condition. The equipment we use ensures a comfortable and pain-free experience. Most patients actually fall asleep during the treatment. It has a high success rate of 80 to 90%. It's a gentle and progressive healing process. No downtime or recovery. Patients can resume normal activities after treatment. Spinal decompression is well researched by major institutions and was originally invented by Dr. Shiley, a medical doctor, back in the 1990s. What about deep tissue robotic laser and the rest of the decompression protocol? Spinal decompression is an amazing tool, but it's the protocol that makes the difference. We combine spinal decompression with deep tissue laser therapy to get better results. Deep tissue laser increases blood flow into the tissue and flushes edema to speed up healing. When you combine this with gentle chiropractic care, specific rehabilitation exercises, nutritional support, and home care support, we had an 87% success rate in 2024 with our 3-month treatment protocol. What about insurance? Unfortunately, spinal decompression is not covered by OHIP, but most work benefit plans in Canada do cover spinal decompression under chiropractic care. Every plan is different, so you will need to see if you have coverage for chiropractic care. How much does treatment cost? The cost of spinal decompression therapy varies depending on the severity of your condition, but most treatments in Canada range from $125 to $200 per session. In my office, we charge $150 per visit. A full treatment plan can range between 15 to 30 visits depending on your individual needs.
I felt like I had a bad case of sciatica on my left side, and I heard good things about Dr. Cameron's office. I couldn't, my walking gait was different, and I couldn't put a lot of pressure on my left foot. Well, I would say 80 to 85% improvement. Certainly the walking and the gait is way better. Almost back to 100%, but not quite. It's not worth living with the pain, and you can't just do it on your own with just simple exercises yourself.
How do you know if you're a good candidate for spinal decompression? To determine if spinal decompression is right for you, we need to perform a thorough assessment, which will include patient history and physical examination, review of your imaging such as x-rays and MRIs, and taking of x-rays if necessary, orthopedic testing to pinpoint the source of your pain, a consultation to discuss lifestyle factors that may be contributing to your condition. What are the next steps? If you've been suffering from back pain, sciatica, or disc condition that hasn't responded to other treatments, it's time to take the next step. Give us a call, 519-227-1363 to schedule a consultation. At Cameron Family Chiropractic, we specialize in spinal decompression and have helped countless patients avoid surgery and reclaim their lives. If you're tired of dealing with pain and want real relief, call us today. I look forward to helping you get back to living pain-free.